Hi class, my name is Lexi Kuhn. So the topic that I decided to discuss today was the nervous system. I chose this because I've always found it interesting to learn about how the human body is able to move and feel things through the connection of our nerves. So the first article that I read was titled Alzheimer's Disease: The Road to Oblivion. So Alzheimer's is the most common form of dementia. And before reading this article, I actually always thought that dementia and Alzheimer's were two different things. I didn't realize that Alzheimer's is actually like a form of dementia. So, early signs of Alzheimer's disease is a gradual deterioration in cognitive and functional skills. There are many psychological problems that come along with Alzheimer's disease. So, a third of the people with dementia will have significant depression. Uh, Often, they have delusions, including believing that people have stolen a possession or wish to harm them. They can have hallucinations, and then people with Alzheimer's disease typically will experience bouts of physical and verbal aggression as they begin to lose their memory and their understanding of where they are. So we don't know the cause of Alzheimer's disease. And while we don't know what causes it, we do know that those who develop Alzheimer's disease have a high amount of amyloid plaque and neurofibrillary tangles. So what amyloid plaque is, they're sticky patches formed by insoluble proteins surrounded by the debris of dying nerve cells. And then neurofibrillary tangles are from an alteration of the protein called tau, which helps to support nerve cell structure. So the second article that I read was called Amyotrophic Lateral Sclerosis, Lou Gehrig's disease. This is also known as ALS. So it's a progressive neuromuscular condition characterized by weakness, muscle wasting, and fasciculations. Approximately 30,000 Americans currently have the disease. One fact that I found interesting is that it is more common in men than women, and it is usually diagnosed in middle-aged people. So with ALS, over a period of months or years, people will develop severe progressive muscular weakness and other symptoms caused by loss of function in both upper and lower motor neurons. The patients will eventually become completely disabled, often requiring ventilatory support and gastrostomy. Death usually occurs within 5 years of diagnosis and is attributed to respiratory failure. So, like Alzheimer's disease, we also do not know the cause of ALS or Lou Gehrig's disease. So, the last article that I read was titled What Contributes to Quality of Life in Patients with Parkinson's Disease. So, Parkinson's disease is a neurodegenerative disorder that affects predominantly dopamine producing neurons in a specific area of the brain. So, people with Parkinson's disease will experience tremor, mainly at rest, and described as pill rolling tremor in the hands. And then other forms of tremors are possible. They'll have bradykinesia, they'll have limb rigidity, they'll have gait and balance problems. So the article identifies some key things to look at when helping someone with Parkinson's disease have a better quality of life. So what the article identifies are the things that impact quality of life in patients were depression. Those that have Parkinson's disease can tend to become depressed due to the loss of control over their body. Disability, where people just aren't able to do as much as they could before. Disease severity, so people obviously with a worse case will have a lower quality of life than those that are able to do more. And then cognitive impairment also impacts their quality of life. So one thing that I found interesting about this article is that patients who had problems walking recorded lower quality of life scores than those who had severe tremors. So people that struggled to walk are probably going to have be more likely to be depressed or overall just have a lower quality of life than those that have a really severe tremors. And that's all I have. Thank you.